Hi, Sydney.
Hi, I don't know what happened with my account. It like removed me and then I need my background.
Oh yeah, did you get the Canva?
Recording in progress.
Hold on.
Oops. Hi, Anna. Okay.
Hold on. I got it now. I need to download it as I assume, right? As a photo.
Está prendido.
Do you have the link for the slides, Marlene?
Bueno, I can mute and then you can.
Can you hear me?
Yeah, I can hear you. How do I change my background now? View my
If
profile.
I talk, you guys can hear me?
Sí,
Can you hear me, Cindy?
sí. Yeah, I can hear you.
Ponme su audio porque se acuerdan que usted cuando está en, cuando yo esté en mí, voy a tener mi audio off. Cuando usted esté,
¿Sabes cómo cambiarme mi background?
audio on.
Marlene, do you know I can change my background?
Yeah, so
Oh,
Right.
video and effects. Okay, hold on. Virtual background. How can I?
okay. So what you're gonna do is you're going to,
I
I
think I
believe,
found it.
click on the
Hold on.
three dots that's on the right, top right of your screen.
Hold on. I think I.
It's
Do you have the
And
slides, Marlene?
then where it says video and effects
Can
settings,
Can you hear me?
I can hear you.
Oh, I think I found it.
Oh, okay.
I was just asking if you have the slides.
Oh, I do. Sorry, I didn't
Okay.
hear that.
No, it's okay.
I do. Okay.
No, así sí se oye bien, ¿no?
Okay.
Do you hear an echo?
No.
Okay,
Ok, entonces está bien.
Anna, can you unmute?
Okay.
Can you hear us? Do you hear an echo?
Yeah, sí, sí.
Oh, I hear an echo. I'll just mute Anna. We'll both unmute when.
Yeah. Luego cuando tú hables, yo estoy al mío.
Okay.
Lo único que hice también es bajarle un poquito el volumen y eso no me deja escucharte eco.
Okay, está bien.
O si quieres todo.
Should I change my background or is this okay? Sí, ¿verdad?
This is good. Yeah.
Me pongo uno de los que no estén tan blurred. Ah,
I'll be sharing my screen. Got my script ready.
okay, we have the first guest, Judith
Did
Guerrero.
you
I'm
send
gonna
a
give it a few
reminder,
minutes.
Sydney?
Sorry?
Did you send a reminder?
I thought it was automatic. It's not?
I'm not sure.
Did you get it?
Oh no, I didn't.
You didn't.
As a participant, I did not.
Okay, let me see if I can send it now, even if it's. Do you know how to send a reminder?
What was that?
Do you know how to send a reminder?
Do you have the list of the people who signed up?
Yeah.
Okay, just if you can get their emails, just copy it and then send a personal one, just BCC everyone.
Oh, but there's not like an automatic.
I don't know. I don't know about Zoom, but I would just get everyone's email and BCC them and said, hi, everyone, looking forward to seeing you. We are starting soon. Here is the direct link to the Zoom. Sometimes I know I was looking for it and
I have not used like a reminder through Zoom before. Usually we use like the WhatsApp.
Okay, yeah. Check your email. Did you receive something now? I just resent from Zoom. I could resend the confirmation email. ¿A ti te llegó, Ana? Sí?
I haven't.
But you've been having issues, no, Marlene, with
Yeah, I
receiving?
feel like
I did receive it.
but Anna,
Okay. I have a couple of people. I'm gonna start admitting everyone.
maybe we could do the mini check-in while people are coming in. I don't know.
Okay. Hi, Deb. Hi, Amanda. Hi, Michelle. Hi, Judith, Patricia. We're gonna give people a few minutes to trickle in. Hi, Grace. Nice to see you. Thank you so much for making time to join us today.
Hi, everybody.
Well, hold on. I feel like I admit everyone and then I get more admissions. Hold on, let me just make sure everyone can get in. Hi, Michael. Welcome. Hi, Leah, Anthony. Nice to see you. Hi, everyone. I'm gonna wait one more minute while we make sure everyone gets a chance to join. Hi, Anthony. Marlene, do you want to start just sharing the slides to make sure that everyone can see them? And then we'll get started in a few minutes. While we wait for everyone to trickle in, I want to welcome you all to our first ever State of Impact. This is the first time that we're hosting this kind of event, so I really appreciate you joining us on this first occasion of our overview of the challenges that we are helping the communities overcome. The purpose of this meeting is not to feel like our annual report, which is coming up in a few weeks. It'll be ready for distribution. But this is more of like a bigger picture overview of where the organization is right now, the challenges that the communities are facing, the model that we've been developing for the last 11 years, and the goals that we have for 2026. It's also an opportunity for all of you to meet the team behind Feast. And also at the end, we will have some time for some Q&A. If you have any questions about the work that we're doing or how to get involved, we'll have time to review that later. So I think most of the people that we were expecting have been able to join. So I'm just going to get started to make sure that we are done by 1 p.m. For those of you who don't know me, my name is Sydney and I am the Executive Director at Feast. I've been part of the organization for a little over 3 years. I first joined as their Director of Operations in 2023, became the organization's co-executive director in 2024, along with Amy Wu. And after Amy transitioned out of the organization after over 7 years of service, I stepped up as the sole executive director. With me, I have my team. Marlene, you want to introduce yourself?
Hi, everyone. My name is Marlene. I am the Associate Program Director here at Feast. I've been with Feast for almost 4 years. I started as Program Associate, then grew into Program Manager role, and then this year started as Associate Program Director. I'm excited to be here today to share all of our accomplishments that we've made throughout 2025.
Thank you, Marlene. Anna?
Hi, everyone. My name is Ana Guzman. I'm the Senior Manager, Community Relations. Also a graduate from the program, been here since 2014, and I'm excited to be here and have this presentation for all of you.
Marlene, I think you stopped sharing the slides. There we go. Thank you. Let's go on to the next one. So I want to start by doing a review. Hi, Deborah. Nice to see you. I will start by doing a review of the compounding challenges that we see in the communities that we serve and that our model addresses. I think historically, Feast has been perceived as an organization that works in the food security space, but the presentation today will show how Feast is doing much more than just working in the food security space, because the problems that we are addressing are beyond food insecurity. So these are some of the statistics that we are seeing in the communities across the United States, not only here in Los Angeles. And these are statistics that disproportionately affect communities of color and low-income communities. 1 out of 7 people in the United States are food insecure. 60% of adults are suffering from at least one preventable diet-related chronic disease, such as obesity, diabetes, and hypertension. In a world where we are more connected than ever, 1 out of 2 US adults report feeling lonely or socially disconnected, which is an outstanding statistic because the US General Surgeon has put out research that shows that feeling socially isolated poses the same health risk as smoking 15 cigarettes a day. So this is a really deep uh, health crisis that is affecting people's mental health, but also our physical health, even if we don't sometimes think about it that way. And unfortunately and sadly, these compounding challenges are not only affecting the adult population, but we are starting to see rising rates of diet-related chronic disease in children as young as 3 years of age, with 40% of school-age children having at least one chronic health condition. The food insecurity statistics are also pretty daunting when we specifically look at children, when 1 out of 5 children living in the United States live in food insecure households. So these problems are compounding because they are all interrelated and they all make each other worse. So somebody who is feeling socially disconnected has a higher rate or is in a greater risk of chronic disease, but so is being food insecure. And so we are seeing compounding problems that are affecting vulnerable communities through intersecting angles that are just making the rates of health disparities continue to increase. Can we go on to the next slide, please? So for those of you who might not be that familiar with who we are or the work that we are doing, Feast is a community health organization working at the intersection of these challenges: food insecurity, social isolation, and chronic disease. I would actually even add that we are also addressing chronic stress through the programs that we develop, and I'll talk a little bit more about that later. We address all these 3 or 4 issues together because, as I mentioned, they are interrelated systemic conditions that all have an impact on the health of our communities. Next slide, please. So for the last 11 years, Feast has been building a model that is aimed at improving community health by addressing the roots, not the symptoms of our health crisis. And we have developed these 5 pillars that really are the foundation of how we deliver our programs. The first one is nutrition education. Every one of our core nutrition programs begins with practical nutrition skills that we teach our participants that are relevant to the programs that to the populations that we are serving. So we currently have two curriculums that we teach. Our wellness program focuses on supporting adults that are food insecure with practical nutrition education and skills like shopping on a budget, cooking healthy recipes, reading nutrition labels. So practical skills that can support better decision making. In our family feeding program, our nutrition education focuses on empowering parents and caregivers of children 5 and under with skills and confidence to develop healthy habits in early childhood, which has been shown to be a critical point of intervention that has an influence on long-term health. And in 2025, Marlene will talk more about it, but we finalized the development of our maternal nutrition curriculum. And this program will specifically focus on nutrition education that is supportive for women during pregnancy. The second piece of our model is food access. And this is an instrumental piece of our work because we recognize that food is a foundation of health. If we cannot access food that is fresh and nutritious and culturally relevant, there is no way that we can improve our health. The third piece of our component is the emotional support piece. And this comes from what we call our sharing circles. Every cohort meets 2 hours a week over the course of 8 to 12 weeks. The first part of the class is a nutrition education and healthy cooking demonstration. Participants receive financial support to purchase healthy groceries for the food access component. And then the second part of the class, the participants sit in a circle that's facilitated by the health educator. And this is a space that becomes a safe environment where participants can share how they are feeling. We always start with a check-in. They can share and open up about the struggles and stresses that they are facing. And it also becomes a powerful place of community connection when participants are able to realize that they are not in this journey alone. As part of our sharing circles, we always start with mini meditations or breathing exercises that are helpful for stress management and which are skills that our participants can take beyond the classroom. And the last pillar of our model is that it is always community-led. So through our health educator training model, which Anna will talk more about later, we train community members to lead and facilitate our programs to make sure that they're culturally relevant and that participants have shared and lived experience with the facilitator of the class. Next slide, please. So I'm going to turn it over to Marlene now for an overview of 2025.
Thank you, Sydney. So I'm going to walk everyone through this next slide and share a bit about what 2025 looked like for Feast. As you can see here, 2025 was a big year for us. We want to start with something that we're really proud of. In May of last year, the American Psychiatric Association recognized Feast's work at the intersection of food and mental health. And that was really a meaningful moment for us because it validated the work that we've been doing for years and also helped bring more visibility to our model. And at the same time, it was a really tough year for the communities that we serve. We saw these impacts through the LA wildfires, ongoing immigration enforcement, and delays in SNAP, all which already made it harder for families to access food and also feel safe leaving their homes. So because of this, we had to stay flexible. And that's something that you'll see in like the information that we share. We adapted by without stepping back. When immigration increased, we moved our workshops from being in person to being virtual. And surprising enough, we actually ended up seeing attendance go up. And I think that also just calls to, the importance of social connection, especially in the times where we can be very isolated because of all the external factors that impact, our ability to go out and get groceries due to our citizenship status. And during the SNAP delays as well, we expanded our emergency food distributions. We were able to purchase bulk pantry goods to be able to distribute, so that's gift cards to families. So across all of that, we were able to reach over 3,000 individuals in 2025. And honestly, one of the things that stood out most wasn't just the reach, but it was also the trust, because we were also able to have, participants came to feast during these really difficult moments in our distributions, showed up at our wellness programming as well, not just for food, but also for support, for connection. And I think that says a lot about the relationships that Feast has been able to build over time with our participants and the community. And even with everything going on, our programs stayed strong. We were able to run 9 wellness cohorts here in LA, and we were able to maintain an 85% graduation rate, which, especially in a year like last year, is something that we're really proud of. We were able to graduate 85% of our participants in the program. And we're also seeing that impact goes beyond our attendance. Over 60% of our participants reported improvements in their physical and emotional health. People felt more supported, less isolated, and more confident in managing their health. And we're also starting to see early signs of improvements in things like their A1C, their blood pressure, which also speaks to the whole idea of whole person health. And then one last piece in this slide is that we've also completed our maternal nutrition curriculum this year. So we'll be piloting it in 2026 this year, which is also a very exciting step for us as we expand who we're able to serve. But overall, 2025 showed us what our model can hold. And even in challenging conditions, we always find a way to get creative and adapt to the situations and external pressures that we're put under. And with that, I'll move on to Anna, who will be sharing more about our health educator training.
Hello, my name is Monique, and I am a Feast graduate. When I first
We
heard
also
about the class,
have
I was at
a
the school drive.
participant testimonial.
So I thought,
Can everyone hear the audio? If you can let me know.
hello, my name is Monique, and I am a Feast graduate. When I first heard about the class, I was at a back to school drive for my kids at the Eaglewood Resource Center. So I thought I was just kind of signing up for just like a nutrition cooking class. My main goal was stop eating out, prepare more nutritious meals for your family, and I thought that the class would be a really good motivator. To my surprise, the class offered that and more. Learned so many, recipes that were quick and easy, and my family still loves, because I still prepare a lot of them. A lot of the women in the class shared, tips as well, not just, the instructors. So it was just nice to hear, like just a wealth of wisdom, really honestly. So the class offered so much more than just health and nutrition recipes. There was an aspect that created, this safe space for us to share sort of our stories, some of our struggles, and it allowed me to be vulnerable. And it was kind of something that I didn't even know that I needed for my mental health. I was kind of going through a really rough season of my life. And so I, again, opened up to such an amazing group of women. We need more of these types of services in our communities, not just for the nutritional aspect, but for the mental health aspect of it as well.
Perfect. And this is one of our testimonials from one of our LA Care graduates. And then we have Anna, who will be talking more about our health educator training.
Thank you, Marlene. And now we will talk a little bit about our health education training, in which we build capacity, and also the way we expand and reach communities as well. So our health educator training, as Sydney mentioned before, is where we train community members or graduates from our programs to be able to lead and teach our program. But also like with our partners, we also can train their staff and their community members that they serve on their own communities, and they also can learn the curriculum and being able to adopt the FEAST program and lead it on their own. So that's a little bit of what the health educator training is. But excited that in 2025, we were able to create 4 new training models so we can bring better skills to our health educators so they can teach, like Cindy mentioned, of postpartum and prenatal and postpartum program, as well as our family feeding, and which again we teach our parents and caregivers to develop better skills to prepare healthy, nutritious meals for the kids 0 to 5 as well. But super excited when we take the training of increasing the skills for evaluation health information, especially found in social media, because like sometimes we see a lot of things social media that we think is true, but not is always. So this was super helpful for our health educators to take this training and be able to take this information very serious as we do at FEAST. So, and also in 2025, we were able to build capacity of 3 new partners organizations, the ones that are being trained, and now they're ready to deliver FEAST programs around all Los Angeles community. But I as graduate, and one of my visions, like keep reaching people not only here in California, but also outside. And I'm super excited and happy to have right here in the call, FEAST Virginia. They are being very successful and implementing our wellness program outside of California, serving primarily Black senior women. But the excited outcome is that they have mirrored all the outcomes that we have here in LA. So that keep my vision reaching not only here in California, but I know with leaders like Bev and all of you that are here on the call, we can keep reaching more part of the states that I'm excited to one day do that as well. So this is what we're doing here and with our health educator part. So thank you, and I'm gonna take it back to Sydney. Sydney, you're mute.
I knew that was going to happen when I muted myself. Thank you, Anna and Marlene. I now wanted to share some key insights that we have learned from the past few years of running our programs and responding to community needs. So the first lesson that we have extrapolated from our work is that health decisions happen within complex environments. This is a very important recognition when we are thinking about public health interventions, because we are constantly bombarded with health tips, right? Like we all like exercise more and eat better and your health will improve. But that is a very simplistic way of approaching and understanding how health decisions are made, specifically when we are talking about communities that are living with within food insecurity and with all the stresses that we shared at the beginning of the call. And so understanding that intervention models need to address the lived realities of the communities that we serve, because health decisions are made in moments of stress. We decide what we're going to eat after long work hours, after sometimes we've dealt with crying children or children who don't want to eat what we made. In the case of our communities, sometimes decisions are also made with consideration of what is actually affordable and what we can put on the table and what we have time to prepare. And so understanding that lived realities are complex is a very important starting point when thinking about health interventions. The second is that food is necessary, but alone is insufficient. So we know that food distribution and food access and food rescue is a key component of the work that we do, but alone it is not enough to make a difference in the health of the communities. We understand that the ultimate goal of food access is not only to put food on the table, but that food is actually prepared in a way that is culturally relevant to the person who is receiving it and ultimately consumed and with the intention of improving that person's health. I always like to tell a story that happened to us a couple of years ago with our food distribution. We depend on partner organizations for this program, and we really never know what we are going to receive until it gets to our office. And so a couple of years ago, we kept getting boxes and boxes of eggplant. And we didn't know what to do with it anymore because as we serve a primarily Hispanic and Latino populations, eggplant is not part of their diet. And so for about 2 or 3 weeks in a row, we continued receiving boxes of eggplant that were just going to waste because people did not know what to do with it. So one of our health educators had the brilliant idea of making an eggplant meatball recipe. And she prepared the recipe during the food distribution, provided the recipe printout to the people that were there, and also gave people samples to test. And after she did that, the eggplant was gone. And so I think this is a very important lesson that we like to keep in mind when we are running our food distribution, because we understand that giving people bags of food might ultimately result or end with that food being put in the trash. And so making sure that people have the skills and the understanding of how to prepare that food, what they should be eating, are necessarily skills to pair with food distribution. And the third lesson that has come out of the work that we've been doing is that the model is replicable. Within Los Angeles, we have been able to reach communities that we directly do not have the capacity to serve through our licensing and partnerships. Within Los Angeles, our biggest partner is Providence Health. Two of their LA County offices, one in the Valley and the other one on the west side, in their community clinics, they offer the FEAST program as one of their interventions and services that they provide to communities. And they continue to see improvements in nutrition behavior, in mental and physical health, in confidence, and in skills that we are seeing in our direct services. As Anna mentioned in the previous slide, our programs continue to be successfully replicated in Virginia, and in the past have also been successfully replicated in New York City in partnership with Wellness in the Schools and in Nebraska. Unfortunately, both our partners in New York and Nebraska have stopped the FEAST programming due to funding cuts, but they ran successfully for over a few years with consistent health improvements and outcomes that we would expect to see. Next slide, please. So finally, before we head into the Q&A part of the conversation, I wanted to share a little bit about our goals for 2026. One of our what I'm calling our North Star is to increase our local and external recognition of FEAST as a community health model. FEAST historically has already established ourselves. We've already established ourselves as a key player in the food security space. We've been recognized by the LA Food Policy Council for our work in teaching nutrition. But as I hope you understand by now, and as based on the data that we've been collecting and the testimonials that we hear from the participants that we serve, being recognized as a community health model is one of our biggest goals for the year, especially in the time and place that we are now, where rates of isolation and chronic disease continue to increase year over year. Being able to see, having external partners see Feast as a community-led and integrative and affordable solution to some of these compounding challenges is very important for our continued growth and development. Their second goal is to continue with our workforce development. We are committed to providing more resources and support, not only to Feast certified health educators, but also to community health workers at large with these new models that we've developed, and hopefully being able to provide paid opportunities for their services. Data has shown that community health workers are one of the most effective ways to improve community health through preventative services and work. They have gained increasing recognition from all levels of government, and the fact that Feast has incorporated this aspect to our model since we started is something that we're very proud of. And the last goal that we have for 2026 is continue to collect data and improve the rigor of the evaluations that we perform to really be able to say that our model is evidence-based and replicable. We have been working with a researcher from USC for a little over a year. She's been helping formally evaluate participant outcome data from our wellness programs. She looked at data from 2020 to 2023 and found, if anybody here in the room is a data person, she found statistically significant improvements in nutrition behaviors and skills and confidence. The paper is currently being considered by Health Affairs. We've submitted it for publication in Health Affairs and we're awaiting a response. But I see this as a first step to become an evidence-based organization and have plans to continue improving our data collection to continue support that the claims and improvements that we are seeing are actually replicable and scalable. To finalize, I want to share that we are currently running a pilot program in partnership with Providence Health, Feast, and the LA Regional Food Bank, where aside from collecting our surveys, pre and post program surveys that we typically do to measure health improvements from more of like a qualitative perspective, we collect like self-esteem and confidence in cooking and more like qualitative measures through our surveys. But through this pilot program, we are also collecting biometric data from our participants. So we are collecting A1C levels, which are an indication of diabetes or pre-diabetes. And we're also taking blood pressure measurements pre and post program. We piloted this pilot back in 2023 and 24. Our data collection was not as clean as we would need to be able to formally evaluate it, but there are indications that the program did have an impact on reducing blood sugar levels and blood pressure measurements in our participants. So the pilot has restarted again this spring. It's going to run through the end of the year and then will continue into 2027 and 2028. But by the end of this year, we will have collected a large enough sample to be able to formally do an evaluation. And hopefully, my hope is that we will be able to prove that our intervention is actually having an impact on diabetes rates and on chronic disease management and reduction. So stay tuned. I hope to be able to share an update on this specific study in our 2027 Feast State of Impact meeting. But if you ever want to learn more about what we're doing, I'm always happy to go into more detail at a different time. So that being said, I'm gonna stop here, and we're now going to turn it over to all of you who are here. We're happy to answer questions. Dana, it's really nice to see you. I just saw you and I got excited. And yeah, I will turn it over to you. Feel free to put questions in the chat or just raise your hand or unmute yourself.
Sydney, are we still gonna conduct the poll?
Oh, yeah, we had a poll. I forgot about the poll. Are you able to see it? You are? Okay. So maybe let's do the poll first, and then we'll go to the Q&A.
I've launched it, Sydney.
Yeah, can everyone see it? Can you all? Yeah, you can all select. Exactly. Let's just wait one more minute. Make sure everyone who wants to answer can. Okay. I think we can end it now, Martin, because I think the ones who haven't answered is, oh, we got. Then it's just us three. Okay, I'm gonna end it now. Okay, so it looks like most of you were here to try to understand our model and outcomes, and I hope that this presentation has been useful for that. But once we go into the Q&A, we're happy to answer questions or provide more detail. And we'll also talk about opportunities to support or get involved with our work towards the end. And it's also nice to meet you, for those who are here to meet us. Okay, stop sharing.
Hi, Cindy, we have a question in the chat.
I'll read it out loud. You mentioned the challenges facing the community in 2025. What are you seeing, experiencing so far in 2026? That's a great question, Leah. Thank you. I'm going to say something and then I'll pass it over to Marlene and Anna. I think that this year, I mean, 2025 was, in LA at least, was a particularly I feel I don't even have to explain it, right? Everyone who is here knows what I mean, we started with a bang and we ended with a bang. So I do think that this year, the immigration enforcements have still continued to be a very big source of stress for the communities that we serve and has impacted their sense of security and their sense of trust. So it is an environment that we continue to navigate. But beyond the immigration enforcement, I mean, and it's not just immigration enforcement, right? It's the entire political environment in which we are currently living has been challenging for the communities that we serve. Next week, on April 1st, some of the SNAP eligibility requirements are going into effect. So I am sure that those changes will increased pressures on people that depend on the program to put food on the table. And Feast is really hoping that at least the communities that are local to where we are able to turn to us as a resource to continue having access to food and the right to be able to feed our family, which is not something that should be a political issue or something that should be politically debated. Marlene and Anna, is there anything else you want to add, given
Yeah.
you're more on the ground?
Yeah, I can share on the programming side. As you may or may not know, Feast recently moved offices from Mercado La Paloma to a building that belongs to the church on San Pedro and 30th Street. This means that we're now in a new community. I wouldn't present it as a challenge, but if anything, an opportunity to be able to expand our reach. Since it is a more residential area, there's an elementary school across the street, which we foresee it being like a really great partnership that we can have, especially for our family feeding program and just our general wellness. I do think that we have been limited with overall staff capacity just because, right now we're a solid team of 3 with our contracted health educators who always do amazing work. But then there is that outreach recruitment piece. How do we engage with the community members, right, when we're multitasking? So I think that has been a challenge. So there's that one piece, but then we also have the piece of our community health workers, also known as promotores, promotoras, who get trained to be able to become a resource to the community. And since last year, we've been getting a lot of inquiries from our community health workers who come to us, wanting to bring Feast into their programs, wanting to bring Feast into their communities. But the issue has always been funding. Where do we get the funding to get trained? And then when we do get trained, how do we get the funding to get licensed? And so Anna and I both started talking, how do we make this accessible? And so we've created a pilot, Promotoras Service-Based Scholarship. Title is still tentative. We're going to work on that as we develop it more, but we basically trained 8 promotores this year, where they take our training and then they can provide us with 30 hours of service. And with this, we've wanted to make it intentional and meaningful, not just as a way to use their labor, but rather make it an opportunity for their own professional development in ways that they can also learn how do they lead a workshop, and so that's going to be, we're going to assign them into roles where they'll be doing nutrition education, food demo workshops, as well as learning how do you do research in a community and conduct outreach. When do we recruit? So they're going to get a lot of activities where, one, they're supporting Feast in our mission, but also they're getting more experience and insight into what goes into the back end of our programs. And I'm also thinking of doing a resume workshop with them as well, so that not only do they get the experience with Feast, but I'm also going to help them build their resumes up. And so that has been a challenge. It would be nice to be able to get more resources to be able to fully develop this and, in the future, be able to actually contract them as our health educators. So I think it's always that one piece, but I am, hopeful. I think with, Sydney and Anna, we're very flexible and we get creative with the resources that we get. And this is just a mini story, but today, we did receive a grant that we're able to purchase vouchers for farmers market tours. So today we had our first farmers market tour, where we host exact promotoras come with us so that when they learn it as a participant, but also get an idea of upcoming activities that they'll also be a part of, that they'll be leading for our Feast graduates. So that's very exciting. There was many who didn't know that farmers market existed right around the corner of where they live. And yeah, everyone was excited. And I think it's a really great resource with the farmers market, because then they get to double their bucks if they have SNAP or EBT. So, it just feels very, I think we're just helping one another. So I would say those are challenges, but I think we've also been able to get creative around them. But I think the biggest challenge so far has been resources.
Thank you, Marlene. Anna, anything else you want to add in
Yes.
from the community perspective?
Just a little bit. On the other hand, like Marlene said, we try to do these activities in order for us to support like our promotoras and professional development, personal development. But we always face like some other challenge. They are getting super excited because of the way we teach these classes, and they already wanna like to go teach us everywhere. And again, like we always get to the challenge of, we don't have the funds to really support them for them to take fees everywhere they want to do it, but we really are trying to build like the personal develop for them, and like help them how they can make the connection in case they probably know our organization, they are running like a food program, how we can do that connection as well. So yeah, but it's always finding another challenge that, I wish we can just go, and like now that you guys are prepared, because they already feel prepared to go teach, they want to go, oh, can I teach here? Can I teach it? But like, is when sometimes it's hard like to just turn back and say, well, at the moment we are facing other challenges in order for us to start those programs, but we hope that in the future definitely they can teach and became more contractors like Marlene mentioned before.
Thank you, Anna and Marlene. Are there any other questions?
Yeah, we have an chat.
Oh, but I responded to Judith in the chat. Yeah. We have another question from Leah, which says, if FEAST got a large donation or unrestricted grant today, how could this investment be used to innovate, expand, enhance, or scale FEAST impact? That's a really great question, Leah. I think that I know that we already have a very strong strategic plan in place, and we understand what we need to be able to reach those goals. I shared some of them during the presentation, but our ultimate bigger picture goal is not only to be able to become evidence-based, but also to build the infrastructure and the internal capacity to sustain an expansion outside of Los Angeles. We've already proven that we have the training model and infrastructure that we need to be able to replicate and to be able to provide our programs as a resource to other organizations across the United States. But building out the internal capacity to be able to make sure that programs that are being taught outside of our own programming is done with fidelity and with the FEAST values and with integrity to our model is something that is very important to us. We also would focus on an internal hire. As Marlene mentioned, we are currently a team of 3, but we would hopefully be able to bring somebody else to continue building the internal systems that we need to continue expanding our work. Yes, Dana, we can share the presentation. I'm glad that you were able to join.
Can I jump? In the other hand, like I also see the again, like we have around our area, we also know other like big organizations that they have not been able to have our FEAST classes, and I think if we have that big donation, we will say yes to, like right now with Promotoras, we have met other organizations that maybe if they know and they able to experience our curriculum or our classes, maybe they can adopt them, seeing how like effective are, because like participation after they join our classes are very high. And I think, and I always believe, for my personal experience being there in the class day one, there is a transformational program. If we have more funds to say yes to those biggest organizations, then in the other hand, when they find out how successful, just as we did with Providence, they are gonna be able to bring us people that we can be training, again, incorporate the training model that we have, and like keep making and train those people so fees can be successful running by other organizations. They are big now and that we can get the connections, but at the moment, like, when they don't know like exactly how a program is, it's hard. And if we don't provide that program free to them, it's hard for them to say, I have the budget, especially with the scholarship portion. So I think if we were able to say yes and run one free program in any of these organizations, after they see the outcome of the program, they will feel more welcome and more secure to come and buy probably our license or train people in order for them to keep running those programs.
Any other questions before I move on to how to... Thank you, Leah. I was just about to transition to that part. So Leah is asking, Feast does amazing work with real, deep, and measurable impacts. How can we all support or be champions of Feast's work? There are many ways to become part or become our champion. Becoming an ambassador for Feast, where you come to us so you can really understand our programs, visit a class. We always have open visits for our classrooms. We have open graduations where we can invite anyone who wants to see our programs in action to experience them. I think the first piece is really seeing the work in action to really understand the impact that we're having, and then being able to talk about it, right? The best way to support Feast is to make other people aware of the work that we are doing. So sharing our work with your networks, making connections. We are always looking for volunteers. We run our food distribution program every Wednesday from our office, and it's a program that depends on volunteers to continue existing. Our volunteers help sort and package the rescued food that we get every week from our partners, and then we are able to redistribute it into the communities. And then we also have always opportunities for event sponsorships, corporate sponsorships, and also our community table program. Our community table program is a community of people that believe that everyone should have access to health and wellness, and who also want to become part of a community of people who are interested in their own wellness and health. So our community table program is our program for monthly donations, and you can join at any amount that feels meaningful to you. This is a program that we're really focusing on growing because it will give Feast the flexibility to continue being responsive to community needs. We are formally relaunching the program in May, but this week I am starting a campaign to find our 100 founding members. Our community table members will receive monthly wellness tips and monthly recipes from our program. You'll get invites to special events. Marlene just mentioned the farmers market tours. This is something that we are hoping to be able to invite our community table members to experience alongside our community members. And my vision for this is to eventually make it into a community of people that are like-minded, that care about the cause, and that also want to find community connections for themselves. So it's not only a way to support Feast, but it's also our way to give back to our supporters in the same way that we try to service the communities that we work with. So if you go on our website, I can put it on the chat, but it's also an easy and very meaningful way for us to get involved and support our work. I'll put it in the chat just so you can read more about the program and the benefits that we are trying to build out.
Thank you, Deborah.
Deborah, thank
Already
you.
shared.
You beat me to it.
I
Thank you.
got you, Sydney.
Thank you, Deborah. I appreciate that. So thank you everyone for joining. I don't see any other questions come in. Please know that I'm gonna put my email on the chat, but please know that we are always happy to explore partnerships, collaborations, answer questions, share more about our work, invite you into our classrooms, into our programs, so you can experience it firsthand. We're also, I'm gonna put this out there, we're also looking for board members. So if this is something that you're interested in being a part of, or know somebody in your network who would be interested in this type of service, please send me an email. It is a really amazing way to become involved in the strategic direction and growth of the organization in a very meaningful way. So thank you all for joining. We will share. I hope did we record? Yes.
We did not record.
Not record.
Oh, I think I got a notice that it was being recorded.
Yeah, I got a notice too, which is why I thought.
Oh,
Yeah,
it
it
is.
says up in the right-hand corner that it's recording. So.
Okay. Okay. Thank you.
This
I
is
have
not
a very quick question.
Of course.
I knew when you were at Mercado La Paloma, didn't realize you had moved. Is the Stanford address on your website the new address?
It is.
Okay, great. Glad to hear you stayed in our district. That's
Yes.
all.
We stayed. We stayed. We're actually also we have an in-person event at the office on April 18th
Okay.
from 10 a.m. to 12 p.m. It's an opportunity for everyone who wants to see the space to come in. But it's a volunteer appreciation event that we're hosting also for the first time to really thank and recognize our volunteers for the work that we do. It'll be a family-friendly event. If you have kids, bring them. My whole tribe of kids will be there. We'll have some coloring activities, and we'll have pastries and juice and coffee and tea, and it's just a nice opportunity to get together in person and meet in person as well.
So I dropped my email in the chat. I haven't checked my calendar yet, but if you could send us an invite, if you'd like us to be there, if we're available, I'd love to come. And even if we can't come, how many graduates are you going to have?
So this is for volunteers.
Volunteers. How many, roughly, how many people are you honoring?
I don't know. We just opened it to everyone who has volunteered. How many registrations do we have so far, Marlene? Do you know?
I think so far we have 6, but I still have to send over more personal invites.
We just started promoting the event.
Yeah, because what I was going to say, I mean, if it's hundreds, then we probably can't do it. But if it's a manageable number, our office supplies certificates of recognition, and we often give them out for things like this. So that's why I dropped my email in the chat that if you can supply us in advance, like maybe 2 weeks notice, 10 days notice, with the volunteers' names, we'll be able to provide some certs for you. They look really pretty.
Oh, thank you. Thank you, Deborah. Yeah. Yes, we will take you up on that offer, and thank you for offering.
Awesome.
Yeah.
All right. Thank you.
Thank you. Thanks, everyone.
I did see Michael and Grace unmute Sydney, so I'm not sure if they wanted to share something.
Oh,
No, thanks for having me.
thank you, Michael. Nice seeing you.
Hi,
We're having lunch.
Thank you,
Enjoy.
Everybody.
Michael,
Thank
for
you
being
for coming.
See
here.
everybody.
Good to see you.
Thank you. Thank you,
So nice to
Max.
see
Thanks
you.
for
Bye-bye.
joining.
Bye, everyone.
Yeah,
Bye.
thank you. Bye.
Bye, Grace.
Hi, Dana.
Okay, I think I'll end it.
You want to stop the recording?
Yeah, do you want to stop the recording? It was you who started it, no, Marley? Oh, there it is. Stop recording.